Hey guys, Brandy here. I am now 9 months post-op of my artificial disc replacement surgery. Sorry about the pile of clothes on the bed, but I've got a lot of clothes to fold. Um, anyway, I've done really well. Um, it's been a journey. I'll say that. I felt great at ever since 5.5 weeks. I felt like I was like so much healed, like I was like 95% healed. But I had some complications, like I had vocal cord dysfunction. I'm still not 100% with that. I still feel like my voice is a little raspy and dry, and it could be just due to allergies and other things. But I was diagnosed with vocal cord dysfunction, and I don't feel like I can push my voice as best as I could. And I still deal with some neck pain, although it's a lot better than it was. However, so much better than it was that I could never regret surgery, even with the complications and everything else. But I did fall. I was, like, say you get dizzy after the surgery, so it leaves you easy, to get re-injured again. But I didn't get dizzy on this occasion. My father-in-law, we were at the store, and I went into the store, and my father-in-law was watching my son, and he cried for me. And I was looking back at him, kind of waving and talking to him, and I just totally was wearing my sandals, and I just totally tripped over the curb and flew across and just landed, just flat out. And I just about bawled, not because of pain, but because I was so worried about my neck and because I was doing so well. And I was worried about my knees because my knees were bloodied and busted. I had knee pain for 2 weeks. And the knee pain went away, and it was like 4 days after I started getting neck pain. It didn't happen immediately, so I thought I was in the clear. But it's not really much, it's only on the left side of my neck, and it's just lower left side, like right here. It goes down to my shoulder and kind of goes to my collarbone, and my shoulder will lock up. Like lifting my arm, my shoulder will lock up. And at this point in time, prior to the fall, I was having just mild neck pain and mild shoulder pain, like stiffness. They wanted to send me physical therapy for, but the pain was really mild. It wasn't anything debilitating. But this right here is bad. And my doctor did an X-ray and was like, the disc, it looks like it's in place really well, and that's all he'd do. Didn't send me to an orthopedic because he doesn't do shoulder anyway. He does spine and brain. That's what neurosurgeons do. But he just, we can send you to physical therapy. I started going to physical therapy, and I'm then after, a month, I'm like, forget this. This pain is getting worse. So it freezes up. My shoulder will completely lock. So when I sleep all night, it's so bad. In the morning, I just in tears. Trying to push to get myself up out of bed is hard. It is so much pain. And even right here in the front, like my neck and collarbone, feels like it's in the muscle, or it's like pulling and the ripping going to get up. So it's just kind of like right here in this part of my neck, just right here and right there. But it's really bad in my shoulder. So I'm going to have to go and get that checked out. I'm pretty sure, it might not be related to the fall. And I've heard people say it could be spurs that have grown in my neck or in my shoulders, or it could be anything. I'm thinking it feels like tendons are ripped or something, and those won't heal on their own. I'm hoping at all costs to avoid a surgery, another surgery. Besides that, over the past 6 weeks, I've developed low back pain. I'm not sure if that was related to my fall that happened 3 months ago, because this just started over the past 6 weeks. I'll wake up with intense low back spasms. I want to try to get a different bed, but they are very intense. It wraps around the front of my stomach, and it feels like contractions. And the spine, you can feel it in the spine. I'm pretty sure that there is a disc out in my lower back that's going to have to be checked out. People have said that spine surgery leaves you susceptible. If you have one spine surgery, you'll be back for another. And I'm on some groups, some spine surgery groups, and I've had people ask that, and people have said that. There's so many people in there that's had multiple surgeries, and they said, yeah, if you have one, you're susceptible to another. I'm not trying to scare you against this surgery. I'm trying to be very, very realistic and saying that if you can avoid this surgery, to avoid it because of that. Because you might feel great for a while after having the surgery, but then if something comes up, um, something comes up. Now, if you have, say you fall and get hurt and you injure a disc and they tell you it's compressed and you're going to have a disc replacement or a cervical discectomy with fusion, one or the other. If they tell you that and you don't have any kind of arthritis or osteoporosis or anything, you probably will be fine. I had osteoporosis, and it would have probably been better for them to do a fusion than instead of doing a disc replacement, because I've heard if you have osteoporosis or significant arthritis that it leaves you susceptible to not really healing as well as you should. So always get more opinions. Always, always. My one lesson, I only got one opinion. He was a top rated surgeon, so I went to him. I knew I'd need surgery anyway. Before I had the surgery, I did read something about if you have arthritis, it would probably be better to get a fusion, but I was trying at all costs to avoid a fusion anyway because it leaves your other adjacent disc at risk of deteriorating because it puts pressure on them. And seeing that I had C6 and 7, that was a mild herniation, he didn't want to fix that one. He didn't want to fix it. He would, and I'm young. He preferred to do a disc replacement. And thinking about it, I would prefer a disc replacement, absolutely. But I was worried about healing because there was arthritis and I have osteoporosis. Too young for it, I'm 35. But he says after, if you're in your late 20s and or in your 30s, a lot of people have some level of osteoporosis, starting in as much as in your 20s to 30s. I've had it since I know I was in my mid 20s. When I had some degenerative changes, it was checked out in 2012. I was probably 25 or something. I'm 35 now, so I'm not even going to add right now. But anyway, I've been doing really well. Besides, I did have the vocal cord dysfunction. I cannot push my voice as much, or I feel like my voice is giving out, or I get short of breath. So when I had the vocal cord dysfunction, I kept getting really badly short of breath. And it was scary. I thought I was having asthma. They even gave me asthma medicine. Totally wrong thing to do when you have vocal cord dysfunction, because asthma medication really messes with your vocal cords. Anything can irritate your vocal cords. Drinking coffee can irritate your throat and your vocal cords. And so they gave me Prilosec in case I had some silent reflux. And it, told me to not drink coffee and to not drink coffee or soda, or not really lay down long after I eat and stuff like that. I had a little bit of throat issues before I had surgery. So they think I had silent reflux. And just by having the surgery, it just made it worse, leaving me with vocal cord dysfunction. And I went to some talk therapy or vocal cord therapy sessions, and they kind of massage it out, and it's very weird. Like they pull on one side, pull up, and and then you do some speech things that are kind of strengthening. Like, it kind of strengthens your vocal cords. It makes them stronger. And I noticed that it was helping, and I was taking the Prilosec. So it all got better. Besides, I sometimes get a little bit of a sore throat, and I sometimes can't push my voice as much. But it has gotten so much better than it was. So I'm very happy about that. I'm just hoping that to avoid another surgery. And it's been a journey with this surgery. I guess not because of the healing necessarily, but because of a few complications and then falling again. And so it's been a little bit of a journey. But I think if you're in so much pain that you can't hold your head up long periods of time like I was in, I can now hold my head up longer periods of time. Long periods of time now. I mean, literally almost no pain in my neck, besides this one section here. It makes it so debilitating in my whole shoulder down to right here in this area here, my collarbone. It feels like it's not in the bone, but like in the, it'll, like I'll go to get up out of bed and it's just horrible pain, like it's pulling me, like it's ripping. It's really bad. And I don't think that was due to maybe like, I don't think it was due to the surgery. I think it was probably due to falling. And it just didn't affect me right away. I'm not really sure because I talked to a lady and she had this surgery here in the US and she went back and had a revision surgery in Germany. What they found out was they used a disc. People in the US are not as experienced in the surgery. They found out they used a little bit of a disc size that was too big and it was leaving pressure on some nerves and some tissue, and I don't know, she developed a spur and some other problems, and she had similar symptoms to me because they used a little bit too big of disc space. So if you have to use the US because you don't have the money to go to Germany and your insurance may not cover it. I had to do it in the US. I have a really great neurosurgeon. He's not as experienced in these surgeries. He's not as experienced at all in these surgeries. So it's kind of a gamble for the disc replacement. And they say artificial or dissecting ACDF is still the gold standard for this surgery. They've been doing it for 20 plus years. It's still the gold standard. They know the success rates and all of that, which a disc replacement has about the same success rate, with even more benefits of, less risk of adjacent disc disease, a little bit quicker healing time. So, it's really hard to kind of think if you're doing the right thing or not. The only thing that I can say is have this surgery, and if for some reason it's better to have this surgery, I think you can always go back in and have a fusion. If it doesn't work, you can always go back in and have a fusion. If you have a fusion, you can't go back in and have this surgery. So the best thing to do would be to have the disc replacement, and if you have any issues, you can go back and have a fusion. You also have more mobility having the surgery. You have more mobility. You can have more rotation of your neck. Now, from what I've learned, that's a good thing and a bad thing. Like, if you don't have a lot of arthritis in your neck, or depending on how bad your neck is, it's fine if you have this disc replacement, but you want it fused and stable. If you need that if you have it like really bad neck, and you want it fused where you want to prevent so much motion of it rubbing against, because it can cause other issues. I don't know everything, but they fuse it where it's like more stable. So I'm going to actually have my test done to see what's going on here, because the doctor did not do that. I feel like my neurosurgeon's like, he has surgery, he's not going to take any responsibility and just do any more tests. He feels like, oh, for success, you're out of here. I feel like they should care more about patients. I told you I fell. I'm not saying it's your fault. I fell afterwards. Could you see what's going on? And just, oh, your disc looks fine. They did an x-ray and the disc looks fine, but I know this is in the tissues. I can feel it. So it could be in the nerves. It could be something, but something's not right up in there on the side of my neck and my shoulder and right here. My left side of my neck and the back of my neck, it'll sometimes get a little tiry feeling. I don't know how to explain it. I'll just massage it because I'll have my neck up all day and I'll just continually massage it throughout the day because it gets a little tiry feeling, but so much better than it was prior to surgery, besides this issue here that I'm dealing with. So I have to go in and see what's going on. But I've done really well. Besides that complication after surgery, I also had Horner's, where one pupil is much larger than the other. It came and went for a while, and now I don't see it much anymore. I'll occasionally get it. I just think it's really strange. They can't give me any explanation. They did say that's kind of common, but no clue where that came from. And let's see what else. Besides that, it was really weird because at 5 weeks, I started feeling a lot better after the surgery. I swear it just felt like the first 5 weeks were so slow. Recovery was so slow. But then at 5.5 weeks, I woke up one day, Because at 5 weeks, I was feeling like I did at 3 days post-op. I truly was. And I woke up one day, 5.5 weeks, and was pain-free for the longest. But then at 6 or 7 weeks, then my vocal cords were kind of doing weird stuff. You know, I was dealing with this, feeling like I couldn't catch my breath, or like they say, it's kind of like my vocal cords were tightening. And I had to learn some breath techniques and talking techniques, and just crazy, crazy, crazy. I've had a lot of surgeries and never had any complications for something, so from a surgery, so maybe I'm just kind of biased towards having to deal with, you know, what I've dealt with. But besides that, I was also dealing with some weird pelvic pain, and you know, I went to the doctor and I had all these tests. I also had some burning in the vaginal vulva area. That's kind of embarrassing to say, but I had all the tests. I had no sexually transmitted nothing. I had a pap smear. I had all of these tests. I knew that I didn't have nothing sexually transmitted, but I was testing for vaginosis and you know, BV, or you know, and they couldn't find anything. They gave me some medication in case it was yeast, and I was still having this weird issues with it. I'll swear it could be related to the spinal surgery, but why would I have this? They said it could possibly be that I was having more feeling, and it was related to that because they couldn't find nothing wrong, and it ended up automatically just disappearing one day. But I suffered. I would keep like ice packs on that and sit in bed, and it was painful. And I didn't have pelvic pain that hurt so bad. I had tears in my eyes, and they could give me no explanation. It was bad. I thought I had pelvic inflammatory disease because I would have the worst cramps and pelvic pain, that it hurt to even breathe, and I was just like in so much pain, and they cannot tell me if, you know. So I started doing research, and I read some others. Even one man said he had testicular pain and burning. That was really bad after the surgery. And I'm thinking, what in the world? So I really do think it has to do, if you have significant spinal compression, that has to do with kind of like nerves regenerating. You'll have some weird stuff. And there was some other weird symptoms I had, and it really messed with my anxiety. If you're prone to anxiety, it really was scary. And at this point, sometimes I was really regretting surgery because, you know, at one point I was like 6 weeks post-op. I never had dizziness until I was like 6 weeks, and I felt like my neck was feeling much better. But then sometimes I would get dizzy spells. I could sit up and I would be fine. I'd be watching TV. I'd sit up and I'd get dizzy, but it went away quickly. And I would be watching TV and I could turn my head to the left or right, and the room, it would just spin. And that went away after a few weeks or a month or however long. So at 12 weeks, all the weird symptoms disappeared. You know, at 5.5 weeks, I was feeling like I was really healing well. I woke up 5.5 weeks feeling like my neck was fantastic. But then I had all these other pains and just weird stuff. And everything pretty much went away at 12 weeks. By 12 weeks, I was happy with everything because I was feeling great. And I was, until with just mild arthritis type pain in my neck, just mild soreness here and there. I was doing great until I fell, and even after I fell, didn't feel any pain the next day or the next few days. I was doing great. It wasn't for 2 to 3 weeks later when I started having this issue on the left side of my neck. So I'm not sure if it was related to falling or not. And I'm not sure if this surgery can leave you. I have no idea what's going on with my low back now. And, but like I said, I actually tripped over a curb and I flew and hit. I feel like I hit lightly in my neck. I mainly hit with the lower portion of my knees, because that's all that was sore. I couldn't even feel any pain in my neck or upper back, my lower back, no pain. I just was walking with a limp because my knee was so skin up and blood was everywhere. My knees it hurt to walk with my knees. So my knees were the only thing that had pain, and in 1 to 2 weeks, the pain there was gone. Actually, after the first few days, I kind of walked with a little bit of a limp for a couple of days because my knees were so sore. And then I had some little bit of arthritis, like bruisey pain for a good, I heal slowly anyway, so 10 to 14 days later, that was gone. Everything, you know. And then I was feeling great, and then, like I said, a few days later, I started having this pain here. which is pretty significant. So I need to get that looked into. But in general, I do not regret this surgery because I was in so much pain that, like, lifting a coffee cup would bother me. My hand, my arm was weak. Both of them were weak, and just keeping my head upright for 30 minutes was tasking. I would they kind of put it back on ice, and I was in constant pain. I was in constant severe, just so much pain. I can't tell you how many times I wanted to get oral steroids just to be able to manage. The pain was so bad, so bad, so bad. So, but anyway, I am doing a lot better. I don't regret the surgery. I do think, like, if you're just having mild pain, definitely do not have the surgery unless, you know, they tell you it's important because of spinal compression. But look into it and see how much compression you actually have. Because a lot of times they say you don't really need it unless your spinal cord is significantly compressed. If it's just a little bit of a compression, you usually won't need this surgery. Some doctors are surgery happy because they make money. My doctor said, you know, he would only do it if, you know, the compression looked really significant, and mine was very bad. So I had the 2 discs replaced. The other one that was mild was not causing any cord compression. It's just a mild herniation, and he didn't operate on that. Of course, in the U.S., you can only have up to 2 disc replacements. A double disc replacement or a single. I had the double disc replacement, so on the lower level, if I ever have it to get really bad, it would have to be fused, because unless they change it in the U.S., because you can only do a double disc replacement here in the U.S. And so I had the Mobi C double disc replacement, and I think I've done really well with it. I just don't know what's going on here, and if it's related to my fall that I had, which, you know, I flew and landed, but I honestly didn't hit hard up here. So I really don't know if this is the issue there, if it's something from surgery, or if I developed a spur or something. I don't know. I know I had a friend that developed a spur later on down the road. So you kind of look at this, and you kind of look at different surgical or post-op videos, and you think, well, people seem to be healing great around 6 and 3 months. But you want to also look at the ones from down the road, because you never know what can happen down the road having these surgeries. So I don't really regret surgery at all. It is better than it was prior to surgery, besides this issue, which can be very, very bad. It's sort of I have a frozen shoulder. So after, like, laying all night, it's really, really painful in the morning, which is how my neck was prior to surgery. It was really, really painful in the morning, and sometimes I woke up throughout the night. It's what I'm going through now with this, which is so frustrating. It's a pain, but it's a totally different type of pain now. Pain's probably just as bad or close to. Not quite, but close to. But now it's just on the left side instead of, like, my whole neck bothering me. And, like, all of the nerve pain that I had prior to surgery, all that's gone. This doesn't feel like nerve pain. It just feels like something is torn up in here. And it just, like, lifting my shoulder right here is really painful. And so it's probably not even related just to the surgery. It's probably related to the fall, unfortunately. Although I can't be really be 100% certain. But, I will update you guys when I have further tests. So, right now it is January, is it the 8th? So, it's taken me a while to get into a orthopedic surgeon to have x-rays. So, but I will do an updated video to see what's going on here. But I've been doing pretty well, and I do recommend the surgery so far. I'm just, I don't know if this surgery leads you to other surgeries, like people have stated. If you have one spine surgery, whether it be ACDF, ADR, joint replacement, which is totally different, but spine surgery, joint replacement surgery, they say if you have one, it leaves your body susceptible to more somehow. I don't know if that is true, but now I'm having also having the low back issues. So, but it could also be related to the osteoporosis that I have, that just things are slowly wearing away. So I'm not sure. I'm going to try to start a better diet and try to lose weight. And I'm going to try to get on some like bone broth and stuff. So if you're really healthy and all, I think this will be a lot better for you than me, where I have also anti-inflammatory issues. They think I either have RA or lupus. So that can cause some extra wear and tear on your joints, disc, and everything. So, but I think if you're in a really healthy condition, um, when you have this, it's probably even better. So always remember to try to, after the surgery, to be careful, just to try to be as healthy as you can, and I think you'll do pretty well with it. No regrets. I'm just hoping that I can avoid a future surgery. So I am going to try, and have been trying to. I have lost weight. I did lose weight prior to the surgery. I'm like 180 now, between 180 and 90. I used to, at my highest, I was close to 300 pounds at my highest, and I lost weight. It's like 4 years ago. And at the time, I didn't really have any, I had some joint pain, feet pain mostly, and tiredness. And so losing the weight, I did have more energy, and my feet no longer hurt the same. So, but I also have anti-inflammatory conditions unrelated to my weight. So, but just losing weight helps everything too. So that's why I want to lose more weight, to kind of get pressure off of my disc and joints and things. So, I want to lose more weight because I've gained a few pounds back from when I lost weight. Well, probably gained about 10 pounds back from having my son and all. So maybe 10, maybe 15 pounds. So that doesn't help me. And I've gotten a little older, so I'm 35 now. So that doesn't help me. You know, I'm still young, but and this disease runs rapid in my family. So I'm trying to get that taken care of so I can get healthier. So, but I will definitely update you guys. I also got some collagen and bone broth. I'm going to try that, see how that works, and you know, getting extra protein and kind of rebuilding collagen, and you know, lots of protein's good for you, and it's not like I'll have to eat a whole bunch of fatty meat. Now I can kind of diet some and still get the protein I need, and without eating as much meat as, you know, but and that's really good. They say it's really good for your after you have the surgery, or even prior to having the surgery, to kind of you know, it's good for that, and good for healing. So if you have artificial disc replacement or ACDF, it's really good. And they say it can actually help you fuse better if you have an ACDF surgery, which I did not, but you know, it takes longer to heal and fuse if you have ACDF surgery. So it's really good to kind of take collagen and bone broth. Not sure if it actually helps the fusion process, but it does rebuild what you need. Like you need bone to rebuild bone when you have a fusion. So bone broth and the collagen is very good for that. I truly believe it is. I was taking it right after I had the surgery, and I do think it helped me a lot. So I noticed some subtle differences in my other joints besides my neck, my other joints. So nothing so really significantly, but for the month that I was using it, I noticed some differences. I need to start back. I just got out of the habit of not doing it, so I need to get back into the habit of doing it. So of taking it. But anyway, thank you guys for watching. I will let you go. Give me a thumbs up if you like this video. And if you have any questions, I'll be sure to answer you. Anything that you have, any questions that you have at all, I don't mind answering your questions and helping you as best I can. So, but yes, definitely a journey I've been through with my health, and besides this surgery, some other things, but you know, that I'm dealing with. But I'm getting there, and so, but so far, no regrets with the surgery. I can do things now that I couldn't do prior to surgery. The only issue I'm dealing with is this now, and I'm sure if I didn't have this issue that I would be fantastic. And just, I would be a totally new person pretty much if I didn't have this issue here. So, I do think the surgery will benefit you a lot. Just kind of watch out, be careful after having the surgery. Even if it's 6 months down the road and you're not trying to be careful anymore because you're feeling great, just try to be careful, because just re-injury can be very easy after having any surgery, no matter how soon or how late. So just try to not re-injure yourself. But otherwise, I'm doing good, and I will let you go, and I'll talk to you guys later.